Welcome everyone to another episode of ELPA podcast. We call it Small Steps, Big Changes series, building a healthier liver through everyday habits with ELPA, where we are addressing the importance of daily healthy habits, healthy lifestyle, to empower our community with knowledge, motivation, and to essentially support each other along the way. And today I am happy to welcome in our podcast Professor Shira Zelber-Sagi. How are you? Hello, welcome.
Good. I'm so happy to be here. Thank you for having me.
Welcome to Brussels.
Thank you.
Today we will be diving into very important topic that touches people living with liver diseases such as MASH and also liver cancer. And the topic is how to turn what we know about nutrition and its effects on disease and overall health into what we actually do. Right? So from theory to practice.
With the most difficult.
With the most challenging. So I'm really looking forward to peel this onion a little bit more. So today we will be talking also about disease management, nutrition, and the invisible factors that often shape our health journeys more than we realize. So Shira, thank you very much for joining us. Thank you for your time. We know you are extremely busy. So let's start maybe with a big question. Most people generally know what we should do. We should be taking more healthier options, eat better, move more, stress less. But the implementation, as we mentioned at the beginning, there is usually a little bit of a problem, a little bit of obstacle.
Yeah.
What are your thoughts on that?
That's the big question. How do we move from knowledge to implementation? So, people have tons of knowledge nowadays. They can Google everything, they can ChatGPT everything, use AI, build their own diets. But really, when they come to the implementation, it's a huge challenge. And let's also remember, it's a lifelong challenge. It's not an effort that you make for a month or two. It's an effort for life, because if you don't keep the healthy diet, so you will gain weight, you will get back steatotic liver disease, metabolic diseases. So it is really difficult to implement, and there are several reasons for this difficulty. One is that, we don't only eat because we are hungry. We eat because we have stress, we have emotional triggers to eating, especially to unhealthy eating. So eating involves a lot of emotions, and many people eat out of stress, out of depression, out of life difficulties. This is the way to escape the life difficulties, the daily difficulties. You know that most people eat most of the excess calories of the day at the evening, when the stress is going down and you want to relax, and eating is part of it, just to release stress. So first of all, it's really strongly related with emotions. Another thing is the difficulty to change habits. Imagine a child that is used to eat sugar every time he's upset, or something oily, or a comfort food. And now suddenly you need to change all those habits, and this is really a difficult challenge. And it's really important that people realize that even if they have all the knowledge about diet, they can't do it alone. They need some kind of professional guidance, maybe support group, maybe family members to support them, but they don't need to do it alone.
It's actually funny because we just recorded, as you may know, in the past several podcasts about the role of physical activity, nutrition, mental resilience, change of behavior, and you are really aligned on that yes, we know what we have to do, but we need some sort of guidance, some sort of coaching, some sort of mental support, be it from your family or people that you know, or be it from some person that you don't know, maybe a specialist, a therapist. We just heard from the health psychologist, from Josip Kresovic. We just recorded a session about change of behavior and how this external guidelines can support you on the journey. So I guess let's go practical. You are the clinical nutritionist, you are a researcher, and you are also educator who's helped hundreds of your patients to get them on the right track. So I guess my question is, how does this first appointment with you look like? What can our audience expect from the first appointment with you?
So it's not just with me, it's with clinical dietitian with experience, of course. And for the past 25 years, I treat patients, especially living with liver disease. So I put a lot of emphasis on this topic and all the related diseases, of course, obesity, type 2 diabetes, metabolic syndrome, and so on. So of course, when a patient arrives, I look at the blood tests and all the other tests like liver ultrasound, fibroscan, and so on. But the big thing is to look beyond the numbers, to see who is the person in front of you, and not just to look at the pages with the numbers, okay? We need to walk beyond that if we really want to make behavioral change, if we really want to create a trusting relationship with the patient. So I try to figure out who is the person in front of you. What is his or her profession, the family? What is the former experience with diets? What worked for them and what failed? And why? And mainly, why are you here today? What is your motivation to come here today? Let's walk with this motivation and see how we leverage it. And really try to understand what are the expectations from the treatment. And sometimes the expectations are not realistic. Sometimes people want to lose 20 kilograms very fast, and you need to have a discussion with them and see that you can set realistic goals that you can both agree on. It's a kind of a negotiation, it's a kind of a discussion. What are our goals? What are the changes that you are willing or able to do right now? And what are the things that you say, I can't do that, and I need to respect that? So it's really a discussion of knowing who is the person in front of me, what are their needs, what are their goals, and how I can tailor the treatment the best according to these data.
And I really like you're stressing the fact that it's a dialogue. It's not just one-way communication, or you should do this or you should do that, but it's really, as you said, firstly for you asking question to know the person sitting in front of you, right? You really want to know the person, as you said, what are their motivations, what are their struggles, maybe that feelings that they are experiencing while they are speaking with you, right? These are all, I guess, right, triggers for you getting to know that person in front of you, right?
It's the only way that I can really tailor the treatment to the person. If I just give them, a regular page with a diet and say do that, I know it surely will be a failure, and it will be my failure, not the patient's failure. It's important to emphasize, but I don't want to give them the feeling that they fail. So it's really important to, in advance, to see who is the person, what are the needs, cultural needs, socioeconomic needs, what are the economic abilities to buy food, what is the time constraints, can this person cook his meal, do they have the time, do they have the resources, or should we think together about other options like 5 minutes meals, which can be, by the way, very healthy and very good. You don't have to spend a lot of time in the kitchen. So I need really to understand who is the person in front of me to tailor the appropriate diet that has the highest chance to succeed. And this dialogue continues in each visit. It's not just the first visit. In each visit, we check over and over again, okay, where do we stand? What were the difficulties? What were the times where you broke the diet, and what happened? What happened before that? What was the trigger? Was it stress, for example? Was it because you looked at your weight and saw that you didn't reduce anything and you started to feel, upset and decided that this diet doesn't work? So these negotiations, this conversation continues in each visit.
And where do you see is like the biggest motivation for, let's say, individual to come to you for an advice, and then also to come repeatedly and actually work with you on a, as you said at the beginning, longer, like lifetime long period of time?
Yeah, so first of all, many times they come when they have alarm call, they have kind of a test like liver ultrasound or fibroscan showing they have advanced fibrosis. And they come because, they had to come, they're really stressed. So the motivation at the beginning could be as a result of a kind of alarm. I call it like the red light that turned on and your liver is telling you that something is wrong about your health and you need help. But that won't keep for a very long time, this feeling. And to keep the patient motivated, to keep them engaged in the treatment, you need to think of other ways, not just, fear. Fear doesn't hold, thank God, for a very long time. So first of all, I try to calm down the patient. And what is really important is to explain that liver disease is reversible in most cases. This is a huge piece of information they need to know, because they are so stressed and they think everything is lost. But no, there is so much hope in this disease. There is so much we can do with lifestyle modification to reverse liver disease. So this is a very important point. But then the motivation is really coming from other things. It's really inspiring and exciting every time to see how patients who manage to change their lifestyle get motivated because they feel self-efficacy, because they realize, hey, I can do that, I can keep up with that. Maybe I'm not perfect, but I can do some of it, and it's helping. And I see the liver test results getting better. That's a huge motivation. And another amazing thing is that they feel better. The quality of life improves with weight reduction, with better diet, with physical activity. They feel more energy. They sleep better, they have less gastrointestinal complaints, their mood is better. And once a person feels better, this is a really motivating factor to continue with the lifestyle modification in the long term.
But sometimes before one arrives to that point that they can feel it and maybe see these changes, right? There is a certain period of time where people can maybe experience setbacks or lack of motivations. How you keep them, keep going, how you keep them consistent also? What are some of your tips and tricks, as an expert in this field?
It's really difficult, I have to say, and I think that every health professional faces those challenges. And first of all, you need to emphasize that it's not a linear course. Lifestyle modification, it's not linear. It's not like you start and you improve all the time and everything is working just fine. And if it doesn't work fine, then it's your failure, your fault, and you're doing something wrong, and it leads to guilt and stigma and so on, which completely breaks down lifestyle modification process. So what I always tell patients is it's not if there will be so-called failures. For sure, there will be bumps on the road. Always there will be difficulties. Always there will be some times where keeping the diet will be harder for them because they are very busy, they are tired, they are stressed. And
we have also Christmas
and
periods,
holidays,
birthdays, right? It's all part of our life. Exactly.
But you need to look at it that way. This is part of life. You don't need to fear. It's part of life. So maybe in the holidays you won't lose weight. Maybe you'll gain a little bit. It's fine. Just hold yourself together and go back to the diet afterwards. You don't need to think of any difficulty or so-called small failures in diet, even big failures. I hate the word failure, but I mean not every time that you don't manage to lose weight or gain a little weight is a huge failure, and then it's the black or white attitude. Either I'm perfect or I'm completely lost. No, there's a lot of gray, and nobody's perfect. It's okay not to keep the diet perfectly. It's okay if you have the times where you keep the diet less or exercise less. You have your reasons. I respect that. But let's think together, how can we go back to track? How can we support you in getting back to the diet and physical activity as is recommended to you? So no black and white attitude. Don't consider any bump on the road as a huge failure. It doesn't say anything about you. It doesn't say anything. You have your abilities, believe in yourself, and those small bumps on the road doesn't say anything about your personality. We just need to think forward, and we need to remember that diet and lifestyle modification, it's for life. It's part of life. It's not, I don't like even the word diet. It's lifestyle. and you need to keep it for life. So holidays are great. Let's be happy about them. Let's enjoy them. Think in advance, what can we do to minimize the damage of the excess calories or maybe alcohol?
Yes.
Let's think in advance, what can we do? But okay, you won't be perfect. Nobody is perfect. And I emphasize to my patients that I'm not perfect either. So don't think that I do everything 100% perfectly. I don't. I'm human. You're human. It's fine. Let's discuss it.
I think that sometimes can create this fear between, let's say, people living with diseases and medical experts. Like, you're sitting there, all the perfect with all the knowledge. And then on the other side, maybe a person can feel that they are not meeting the expectations, that they are not meeting their goals. So as you said, it's important to have this open conversation and really be realistic about life. It will always be up and down. As you said, it's not black and white. There are a lot of colors in between. So I especially liked then you mentioned the mental resilience. So it's all part of that story. And to that, I wanted to ask you about your opinion on multidisciplinary team. How important is for people living with liver diseases? How this multidisciplinary team can really help and support them on their journey?
Yeah, so it's really important, especially in liver disease, and especially in steatotic liver disease, it's a systematic disease, really. It's not just a liver disease. So there is a relation with metabolic syndrome, with obesity, with type 2 diabetes, with cardiovascular disease, with kidney disease, sometimes cancer, sometimes inflammatory bowel disease. It's all connected together. So there are sometimes people with multi-morbidity and multi-pharmacy, and they need diet for each situation, and sometimes they are confused which diet they should go for at what time. So first of all, you need to coordinate all those things together and help them figure out what is the right lifestyle or diet for them. And you need to work with all the relevant health professionals, endocrinologists, family physicians, sometimes bariatric surgeons, gastroenterologists, hepatologists, of course. And it's really important that we have good communication and interaction between us. So it's not just a multidisciplinary approach, it's interdisciplinary approach. The inter means that we communicate with one another.
And you lead the patient.
Yeah.
On the
it's
journey.
not separate boxes of each health professional. It's that we all interact and communicate and think together what is best for the patients. And I have the pleasure of having a steatotic liver disease clinic in the past 25 years with a physician. So we see the patients together. And this is amazing. It's amazing for the patients. It is amazing for us because we keep learning from one another. We interact. And then I think that everybody in the room benefits from this interdisciplinary approach. And it's really important that the patient will know that they have an address to approach to, that they have someone who coordinates the treatment. It can be the family physician, it can be the hepatologist, but someone needs to coordinate everything for them. Otherwise, it's really confusing.
Also, from the patient perspective, for us, ALPA's Umbrella Association, we really strive for multidisciplinary team and patient-centric approach, right? So patients shouldn't be running around city from one appointment to another, but really to have this safe environment, person that they trust, team that patients trust, so they can really open, right? Because they are speaking about personal issue, personal things, and it's important that you feel safe when you are sharing these things.
Of course, there should be trust. You should build trust with the patient. It's so important. And I didn't mention, but the patient associations are super important in the interdisciplinary approach. And I had amazing experience with patient associations. And I actually tell some patients, I refer them to patient association to get advice. I was talking about coordination of the treatment. So the patient association can mediate the situation. They can explain things and simplify things for the patient in the beginning, especially when they're a little bit shocked by the situation. I think the patients' associations are super important to mediate, to explain, and to give them some positive, encouraging examples how you can live with liver disease and even have, high quality of life.
Certainly, Alpa is supporting all of our members. So I know that you are also closely collaborating with our member in your country. And it's actually a member from your country that is saying that patients talk to patients in a different way.
Yeah.
Would you agree?
Absolutely. No, I think it's so important. I can tell you, for example, that patients with Wilson disease, I always refer to patients' associations. I think the best source of knowledge and encouragement come from there.
And also as human beings, I think we all need some sense of belonging to community or right, the group of people that we can use the certain terminology and that we feel that sense of belonging to, right?
Absolutely. Feeling you're not alone. As we started the discussion, I said, don't do it alone. You have the knowledge, but don't do it all by yourself. This is part of not being alone.
I'm jumping a little bit to the beginning because you said that lifestyle intervention in the scope of nutrition, it's a lifelong process. But I have to ask, for somebody who is just jumping on this change of behavior and eating healthier, how long an individual usually needs to, let's say, make a switch to really, for you as an expert to be able to say, okay, you are now really making changes and see the changes? I know it's a tricky question. It's very hard to answer to that. But
No, I like tricky challenges, challenging questions. What I think is that I try to think if there is a certain point where I say, okay, you made it.
Mm-hmm.
And I can't really say that, and I'll tell you why. 2 reasons. First of all, every positive change that you make in your lifestyle is important. You don't need to do 100% change. You don't need to be 100% Mediterranean diet and exercise at least 150 minutes per week. And then I say, okay, you are so perfect now. Every change that you do is significant. If someone's just used to drink sugar beverages 2 liters per day and you move to drinking water, that's a huge change. For me, it's not less important than having a complete, perfect Mediterranean diet. So every small change is significant. We also know from the clinical perspective that those changes, increasing physical activity even without weight reduction, reducing sugar even without weight reduction, all those changes, they mean something.
Yeah, already affecting it in a certain moment, the physiology of our human body, right?
Right. They improve the liver health. Even if you are not perfect, you don't need to be perfect. So there's no point I can say now you're perfect. Now, let's say a person is really doing a huge change and is establishing and implementing Mediterranean diet perfectly, no sugar, exercising, no smoking and everything, okay? Even then, well, I say well done, it's amazing, but I know there will be difficulties at some point because nobody can be perfect for life. So I know that
it's a very realistic statement, but we like it. We like it.
At some point, he will come and say, oh, I lost it and now it's a difficult time for me to keep the diet and I'm so disappointed for myself. And I want to be ready for that and I want to prepare them for that. And that's why I always say, it's great that you succeed now, but just know sometimes it will be more difficult for you to keep up with that. So just remember that it's okay. Even if there will be more difficult times to keep the diet, talk to me about it. Let's figure it out together. Don't think it's a failure and that you destroyed all the improvement in your health and there's no point in continuing the efforts because anyway you can't keep the diet, because that's what happens usually. People stop keeping a healthy lifestyle because they think that if they failed once, it means they're unable to keep the diet, there's no point in trying and so on. So even when in the point where everything seems amazing, I want to prepare them to the point where difficulties will arise, and let's work on it together when we get there.
I think it's also important to firstly know yourself as a person, like what type of character you are, right? For some people, the small steps, big changes will really be the go-to, but for some, maybe they are really focused on this huge change in a shorter amount of time so they can build that self-motivation that keep them going. So I think it is basically what you said at the beginning, when you have this dialogue to know really the person, what motivates them, what will keep them going once they will experience some sort of setbacks, right?
Exactly. So this is exactly the first conversation with the patient. What are your expectations and what kind of a type you are? Do you need small steps? Do you need big steps to get motivated and to gain self-efficacy? It's exactly what we're trying to figure out.
What are your thoughts on social media and, these, white media streams giving certain suggestions how we should live, what to eat, how to move? Do you think they are beneficial, or they can in some sort of moments be maybe self-destructive, or they can maybe drag us down? What are your thoughts on that?
Well, it really depends on which kind of information we are talking about. Sometimes it's a good information, some tips for lifestyle change, sometimes from health professionals, from dietitians, from physicians, and it could be good information. But sometimes it's the wrong information. Sometimes it gives people the feeling like everybody is doing it and succeeding, and only I'm failure,
exactly.
A complete failure in diet and lifestyle modification. How come everybody looks so good and so successful in dietary changes and weight reduction, and I fail to do it over and over again? So, and sometimes also it leads to stigma. So sometimes the language that is used, or the pictures, or the ideas that are brought there actually increase stigma. So we need to be really careful with that. So I think that most patients would benefit from professional guidance, a dietitian or a nutrition expert to guide them. And then in addition, if they find something on social media, on the website that supports them, that's fine. But it's always good to ask the dietitian or nutrition expert about those things. And actually, the patients do ask me a lot about it. They come to me with all kind of new diets. What do you think about that? And sometimes it's good, and sometimes it's terrible for people with liver disease. So we need to be very careful about it. For example, fasting or intermittent fasting or very radical diets are not good for people with advanced fibrosis. So we really need to be careful with that. So it's always, I'm always open to listen what they saw on social media and on different websites. You need to be open to listen to them and to give them your feedback, but not to give them the feeling like it's not okay that you even look at it. Sure. Because then they won't come to you again with those questions, and you lost something.
You lost the trust.
Yeah.
Thank you, Shira. I think this is very valuable information, because we are living in a digital era. Even if you want, you can't skip all of these suggestions from online influencers and so on. So I really like your comment. Let's maybe schedule at least first session with a professional. Explain what are your goals, what is your motivation, and then take it from there, right?
Right.
Shira, we are moving forward. We've talked a lot about individual habits and personal motivation, but the truth is not everyone starts from the same place. So I'm moving towards social determinants of health. I know this is a topic that you are expert in, that you know a lot about it. So I'm giving you the floor. What can you tell us about this topic?
Well, yeah, you're so right with this question. This is another way to really see the patient, see the person in front of you, beyond the blood test and the liver test, right? So if a patient comes and I tell him, do a Mediterranean diet, eat walnuts, olive oil, fish 3 times a week, and fruits and vegetables, And he says, well, my mother works all day. She's a blue-collar worker, low socioeconomic status. My brother has alcohol use disorder. He drinks alcohol all day at home, and we hardly make a living. What can he really do with this beautiful diet that I gave him that costs so much money? He can't do anything with that. It's worth nothing. So we need to tailor the diet also to the economic situation, the economic barriers of the patients. This is one of the things we need to do. There is the term called food insecurity. People, when they think about food insecurity, they think about hunger.
Yes.
Like you're starving, you have no food. But it's not exactly true in Western countries. In Western countries, it means more the inability to buy the food that you need, the food that is healthy for you, right? So food insecurity means you can afford only cheap food, ultra-processed food, which is high in sugar, in saturated fat, unhealthy compounds, a lot of additives and salt. And it is also a food that encourages eating. We overeat calories when we eat ultra-processed food. So food insecurity actually means you can't afford a healthy food. You can only afford unhealthy food, and that affects, this has been shown in many studies to affect liver health. This is related with metabolic dysfunction associated with cirrhotic liver disease. So we need to realize that there is the thing of food insecurity. It's more common than we can imagine, and we need to ask about it. We need to ask the patient what is his abilities, the family abilities to buy food. So this is one thing. And another thing, we know that people with lower education level, with lower economic status, suffer more from liver disease. And not only they have more steatotic liver disease, the outcomes of liver disease are worse. They have more advanced fibrosis, cirrhosis, liver complications, and mortality. So that means we need to first of all recognize those barriers, economic barriers, and then we need to respectfully, without stigma, see how we can adjust the recommendations, the nutritional recommendations to the patient status. And by the way, it's also physical activity insecurity, because you tell them, okay, exercise, but they walk very hard, sometimes physical walk, some of them. And so maybe the recommendations of, go and exercise 3 times a week, it's not something they can actually do. So we need to be sensitive to all these factors if we really want to succeed with the dietary treatment or lifestyle treatment.
And where do you see maybe a gap in, as you said, it's not just individual choice. We all live in a system, in a country, in communities. Where do you see maybe support from these other communities to the individual when it comes to social determinants?
Where do we see support from the community?
Yes.
Yes. First of all, I'll divide it to several levels. First of all, the health care services should be aware of topics like food insecurity and what we call social determinants of health. There should be more awareness towards these factors. And for example, in the US, there are food insecurity programs. So like the health physician can give the patient prescriptions for fruits and vegetables, which are extremely expensive nowadays, right? So they can provide prescriptions, or there can be like a community market where they sell healthy foods in low prices. So the healthcare services should be aware and it has been shown to be very effective, can support healthy diet. There is also the level of city planning. So some people live in areas called food deserts or food swamps. So food deserts are areas where you can't have access to healthy, fresh food, fruits, vegetables, legumes, other healthy foods. And all you have around you is food swamps, which actually means you are overloaded, you're surrounded by unhealthy food outlets, fast food outlets. So you can't really make the choice. It's not like you really have a free choice. What are you going to eat today, right? Because all you have around you and all you can afford is unhealthy food. So in the level of city planning, we can even, try to balance between the desert and the swamps. We can try to balance that areas, deprived areas mostly. We'll have groceries with fresh foods and fruits and vegetables, and not just fast food outlets. And in the policymaker level, in the even the health professional level, I think we all need to advocate for health promoting policies. We need to change the environment. So we can't only look what a person has in his plate, we need to see what he has outside his plate. How can we make the environment more reasonable and more health promoting and supporting healthy lifestyle? And I think this is the responsibility, of course, of policymakers, politicians, but also us. We are as healthcare providers should not only think about the patient, the single patient that sits in front of us. We should think in a broader way on the community, on the society. And we need to understand that we need to push forward for policies that support health, that what people eat is not only their own responsibility. Liver disease is not a so-called self-inflicted disease because of bad habits. It's because we live in an environment that encourages unhealthy habits. So we need to try together, to work together also with patient organizations to change the environment. Other way, it won't work. I mean, we can treat a single patient and feel like we are having a huge success, but there are so many of those, who need help, and the health system will be so burdened by liver disease if we don't change the environment. So we need really to work together to do that.
I think this is a very powerful statement, what you just said. So actually, we are coming slowly to the end of our session. But in any case, I will give you the floor for like a final messages, final statements to our audience. We touched on a lot of things. I know that there will be a lot of comments and additional questions in the section under the video, but yes, maybe some final statements for our audience.
What I'm really bothered about sometimes is that people judge themselves by their weight. If they're overweight, if they have obesity, they judge themselves by this single characteristic. And moreover, they judge themselves by their ability to reduce weight. Reducing weight is so difficult. So what my ask is, my recommendation is, don't judge yourself by your weight, and don't judge yourself by your ability to reduce weight. You are much more than that. There are so many other things you can do to improve your health. Don't let it be the only criteria to evaluate yourself, your abilities, your value, and your self-efficacy. Remember, you are much more than that.
Thank you very much, Shira.
Thank you.
Thank you very much for your time. I think it's a nice provocative closure, a little bit. So I will just leave it as it is there. Okay. And I'm sure we will continue our discussion also in the future. So thank you very much for your time. And we see you at the next episode.
Thank you, Veronica.
Thank you to you. Bye.
Bye-bye.